Welcome to a special edition of the Bedrock Way podcast, where we explore the latest innovations and advancements in healthcare. I'm Andre Gomez, your host, and I'm thrilled to be joined by our special guest and colleague, Brittany Bruns. In this fast-paced world of technology, healthcare is undergoing a remarkable transformation. And at the forefront of this revolution is Sophia, your personal AI virtual care concierge. Today, Brittany and I are diving deep into the world of healthcare innovation as we introduce you to Sophia, our newest addition designed to revolutionize the patient experience. From streamlining appointments to offering personalized assistance, Sophia is here to redefine the way we think about healthcare delivery. Join us as we explore the inner workings of Sophia, its role in patient care, and the endless possibilities it brings to the future of healthcare, as we streamline the most difficult journey we will ever take in our lives, the healthcare journey. So sit back, relax, and get ready to embark on an exciting journey into the world of Sophia, your AI virtual care concierge. Let's dive in. Welcome to the Bedrock Way podcast, where we're changing the habits of yesterday by creating the new healthcare reality of tomorrow. And one thing that we are very, very, very excited to do is to unveil our new AI virtual care concierge, Sophia. And I have my amazing colleague and guest today that's going to join me into discussing the inner workings of Sophia, how we came about the idea of Sophia, and most importantly, how Sophia will be integrated into patient care here at Bedrock Healthcare at home. So I wanted to introduce a familiar face to our audience, our listeners, and definitely to Bedrock, the one and only Brittany Bruns.
Happy to be back on the podcast. This is a very exciting episode for us today.
Thank you so much, Brittany. And I'm so happy that you're here to really discuss Sophia, because you were there from the beginning when we were thinking about Sophia, when we were having a lot of our I think this dates back 2 years. And I want to take the listeners through the thought process, how we came to, have Sophia become a reality, because it also stems back to us developing the name Bedrock. And today's podcast episode is exploring Sophia, your AI virtual care concierge. So as we explore Sophia, I just want to give the audience a context on how we came up with Sophia, because again, like I said earlier, it aligns itself with how we came up with Bedrock. And I'm going to take the audience to every Easter break. My family takes a vacation somewhere. And 2 years ago, we went to South Carolina, Ocean Isles in South Carolina. And what I do, Brittany, when I go on vacation is I take time to just think, reflect, understand what areas do I need to improve on, how can I get better, and where are we not good enough. And 2 years ago, the name of the organization wasn't something that I enjoyed, wasn't something that gave me passion. And that's when we were thinking about, how do we, revamp the name of our multi-specialty medical practice. And that's where the name Bedrock came to be. However, before Bedrock, the name that I wanted to name our business was actually Everest, because I was dead set on mountains, and I wanted to for our services to reflect the peak that one achieves when they get great quality care. So Everest was going to be a name that I was going to go by. However, as I mentioned Everest to my daughter Sophia, she hated it. And she said, that sounds horrible. Everest, no one's going to like that. And she actually Googled and saw that there are other companies that were named Everest. So what we did at the time is we started looking at titles and titles that we enjoyed, and we came across Bedrock. Bedrock was a choice. And again, I was in Ocean Isles with Sophia, and I said, what do you think of Bedrock? And her response at the time, Brittany, was, you know what, Dad, I do remember that in Bedrock, Fred Flintstone was the vice president. And since you're the vice president, it goes. So we kind of went with Bedrock. But what I loved was that she made everything so simple. It was so engaging. She still is. And she just clarified something that was very complex for us, which was to how do we come up with a name? So I looked at Sophia, who has so much wisdom, and the definition of Sophia is wisdom. So I said, you know what? Maybe I'm trying to overcomplicate the name. So we definitely decided to go with Bedrock. And then as I started thinking about what is the biggest issue we have now with healthcare with our patients, and that's patient engagement, patient follow-ups, patient not adhering to recommendations that are given by healthcare professionals. And as you know, 2 years ago, we were on the heels, or actually in the aftermath of the COVID pandemic, where care coordination and healthcare issues were rampant. So I said, man, we can't go back to patient care just doing it with the same ammunition that we did before. We need more. We need more ammunition. We need more engagement. And that's when the idea of this virtual care concierge came to play, where I wanted to create an AI tool just like Siri, right? Just like Siri, that a patient can simply say, hey, Sally, hey, Marcy, just take my blood pressure. Get my medical appointments for me. Tell me what I need to do. Make the patient more aware of their health. And at the time, that same week, I looked at Sophia and I'm like, wow, if Sophia means wisdom and Sophia is so wise beyond her years, maybe this is what I need to name our virtual care concierge eventually. And you got to think about this, Britt. 2 years ago, our practice hadn't even started, right? We were barely off the tracks. For us to start thinking about an AI virtual care concierge, it was a pipe dream. All right, it was. Let's get the practice off the ground first before we can have a virtual care concierge. So as I started looking deeper in my reflection of Sophia, I looked at the letters, and then I said, "Wow, S. I can really look at services, right? Because we want to create amazing services for our patients." And then I looked at the O, and I'm like, wow, but I don't want to give the same services that everybody does. I want to optimize our services. So we want to work on optimization of those services, because if the services are optimized, patients are going to be more engaged. But I also wanted that our AI tool, because technology is supposed to allow us to predict things, right? So I wanted for the P to be predictive. And then I wanted it to be adaptable and relevant to our patients. So the H, human, the I wanted it to be innovation, and A, analytics, because I wanted the AI tool to be machine learning, to have the ability to have an algorithm where it learns the behavior of our patients and gives them personalized, customized feedback. So that's where Sophia came about. It was going to be a concept at the time that was going to give Bedrock Healthcare at Home the opportunity to provide our patients with services that are optimized, but that are predictive, human, innovative, and have analytics. Again, and that was 2 years ago. And 2 years later, I am thrilled to be able to bring this to the market. So as someone who has been with me along the journey the last 2 years, how important do you feel a virtual care concierge will be for Bedrock Healthcare at Home and for the industry?
It's funny that you bring up that story, because I remember you texting me that week that you were away. And I was like, just enjoy vacation. But you're like, my thoughts are going right now, because we were still in the infancy stage of Bedrock at the time. And for you to be bringing up this AI idea that would take us 2 years to fully evolve, I was excited even back then to start this journey, because post-pandemic, even prior to that, we really saw these deficiencies with our patients, the patient engagement, even from a transportation level. They're dealing with physical and cognitive ailments as well that add layers to the complexities that one would take on a healthcare journey. We saw that even before COVID hit. Then when it did, we really wanted to have that multi-specialty approach with Bedrock, because we saw that they needed it. The senior care that we deliver, the patients, the population that we deal with, this is what they need. They need all of their services available to them wherever they call home. So we started to break apart those issues and those roadblocks that our seniors deal with when they're on that healthcare journey, that highway, that super highway of healthcare. So that was one big goal of ours that 2 years later we've seen such tremendous outcomes with. So then we want to ask ourselves again, what more does this population need to truly be at a level of confidence with their healthcare journey? And that comes with personalization. So now is the perfect time to say, how can we make personalization of these services accessible and easy and efficient for them, while taking into consideration that we're still dealing with issues with personalization with our healthcare, our medications being an issue. We're still seeing transportation issues and obstacles to get to patient appointments. So we're mending and molding all of these pieces that need correcting in that healthcare journey, and now is the perfect time to bring that evolution to that AI level. So it doesn't even feel like it's been 2 years, honestly, because we keep talking about it, we keep evolving it, we keep seeing what's missing within the healthcare world right now, and we're applying it, and we're seeing that a lot of it revolves around technology and that instant access to patient care, seeing the analytics through the eyes of a machine that can filter all of that data and that information and be there at all times with our patients. So it's more than exciting to actually bring this to life now 2 years later.
Listening to you describe it, it's ironic, but not really, that the whole premise behind Sophia is identical to the whole premise behind Bedrock, right? Because essentially, the most difficult journey that we will ever take as human beings is the journey of healthcare. And unfortunately, we take it when we're most vulnerable and when we're unfortunately demented, right? And where a lot of us, when we're older. And you mentioned the superhighway. Absolutely. It's a very convoluted superhighway with a lot of twists and turns.
A lot of exits.
A lot of surprises, and it needs a tremendous amount of facilitation, right? Because it's too complicated. And sometimes I think that the journey of healthcare is complicated on purpose. And think about it. The whole premise behind Bedrock was to end another journey, and that is that fragmentation of healthcare, where providers don't communicate, right? We talked about previously to exhaustion how the long-standing healthcare system is fragmented, is disjointed, is, quite frankly, dysfunctional, where clinicians don't communicate. So the whole premise behind Bedrock Healthcare at Home was to bring a team sport mentality into healthcare, to have a multi-specialty medical practice where every clinician that was part of the healthcare team would be under one umbrella, under one network, under one system. And to your point, that team would integrate technology and biology for the betterment of the patient and the outcome of the patient. And 2 years later, as we've grown our practice in 9 states, it's time for us to now have technology help us with, again, that integration, that collaboration, that seamless approach, and facilitating that journey for our patients. And I'm telling you, I can't be more excited to really discuss Sophia. 2 years ago, this was a laughing matter, right? Because we, like you said, our practice was still in the infancy stages. And today, believe it or not, Brittany, something that really escapes my mind sometimes, technology and care concierge has been part of other industries for years, sometimes decades, right? But yet, healthcare, it's evaded healthcare. And unfortunately, it never made sense to me, because the end user of healthcare is a human being with a pulse.
I think that's a lot of why there's been hesitation with bringing AI into the healthcare space, is that error potential. We are dealing with a human being. It's not as easy as taking AI to look through bank accounts or more tech based companies that need those analytics. I mean, I think that's a huge reason, is the fear behind what that could do when you're dealing with a human life.
But I love when people, again, we have a lot of naysayers, right? A lot of naysayers, a lot of contrarians, a lot of people who are already saying, they were saying 2 years ago that this wasn't going to work. They were also saying that Bedrock wasn't going to work.
I was about to say, they'd said 2 years Bedrock wasn't going to work. So look at it now.
So here we are unveiling Sophia, and then the haters come back up again, right? And the naysayers. I had someone the other day when we rolled out Sophia, they assimilated Sophia to Dora the Explorer, which I'm not understanding the assimilation, maybe because the likeness of Sophia is like Dora, who knows? But that criticism is amazing to me. You know why? Because just like a flower needs to grow with sun and rain, we're going to grow with criticism and compliments. So I say to all the haters and all the naysayers out there who don't think we're going to do this, keep the criticism coming, because it only fuels our mission. And our mission ultimately is not to please the naysayers. Our mission is to revolutionize healthcare. And again, I want to make it very clear to our listeners. The vision behind creating Sophia was to revolutionize patient care and enhance the healthcare experience. That's it.
Funny that the naysayers are going against that concept, because it's so needed. How long are we going to go through our healthcare journey from the senior population perspective by looking in the rearview mirror? We can't. We have to be more proactive with our patients, with our clients, with our family members who are undergoing that complex aging process when it comes to healthcare. You should want something that will revolutionize that journey for them, because you're going to be there someday. Your kids are going to be there someday. Your parents, if not already. Wouldn't you want them to have instant access to their healthcare team, especially one that is of multi-specialty quality, for somebody that's going to deal with multiple conditions and comorbidities?
And on that note, you are absolutely right. This only makes sense. It only makes sense. And again, we're all, unfortunately, going to be at that point in time when we're navigating the complex healthcare journey. And my goodness, shouldn't we opt for an easier journey than a hard one, right? So let's talk about, the technology behind Sophia. I want to give the audience a peek behind the curtain for people to understand the capabilities and how Sophia will operate. And again, not giving too much to the audience, but Sophia will do inclusive of the following. And again, there are other things that Sophia will do. But Sophia will review on a daily basis your vital signs. Sophia will help you schedule doctor's appointments. Sophia will review lab results with you. Sophia will help you manage chronic conditions, as you mentioned, for our diabetics, people with renal failure, people with cardiac failure. It will help them make sure that they are following directions continuously, because this population needs care continuously, right? Chronic care management equals continuous care monitoring. And Sophia will be that AI-infused healthcare concierge that will proactively tell our patients, hey, you need to do the following. Dare I say that patient engagement that our patients need so desperately. So I agree with you, Brittany. Any healthcare organization that doesn't opt for this is going to be in trouble. And one thing I said recently at our conversation at the healthcare conference recently is that while AI may not replace healthcare professionals or healthcare companies, the companies that embrace AI and those healthcare practitioners that embrace AI will replace those that don't. That is a fact. So there's a lot of ambiguity behind technology in healthcare. That's one thing that is not ambiguous. So one thing that I wanted to ask you is, what do you think some of the additional areas with patient care that Sophia might be able to tackle?
Well, you mentioned a lot of what the capabilities of the AI technology will do for that patient, but the big piece that we want to bring for patients is the engagement side of it. So what is all that data without somebody reciprocating that outcome or that understanding back to that patient? And we also want to think of our demographics. So a lot of them might have hearing issues, visibility issues, language barriers. So the AI technology will allow us to actually access multiple populations and demographics. I see this even extending into younger individuals, youth, all the way through the aging journey because of Fitbits and just the fact that technology and healthcare, they are integrating. Perhaps right now it's from a younger perspective, but we're going to take it then from the back end and let's meet in the middle somewhere where the outcomes are actually going to a group of individuals, clinicians that read and interpret and give you that data back on your next steps. So that's where that proactivity comes in with Sophia. Also, just from the repetition, the patterns that need to take place a lot of times when medications come on board, multiple medications typically. A lot of times there's lack of education around those medications. So reminders, medication reminders, vital sign reminders. So that's Sophia technology, similar to how Siri or Alexa would operate, allows that patient to be able to engage with us first rather than vice versa. So, hey, Sophia, my blood pressure is a little high today. Should I set up a appointment with my physician? So as you said, Andre, there's going to be an opportunity for that AI tool to connect them with our team of professionals that knows this individual. They're assigned to that patient. And we can say, Sophia can answer back again in their language and in a mode that they can understand and say, yes, I do think we should set you up with your physician, Dr. Pecora. His availability is Thursday. I'll put you on his schedule at noon. Is that okay? Get a response from the patient. Then we remind that patient as the appointment gets closer. Hey, don't forget, you have an appointment with Dr. Pecora tomorrow. Today, you have an appointment with Dr. Pecora today. So it allows people to engage with that patient more than the family member or sometimes the staff in the community would be able to do. So it almost allows more eyes and more ears around that patient, but not from a standpoint of a companion, a standpoint of your team of clinicians that gets to know that patient from the physical, the mental, and the personal side of the equation. So it's holistic, which has really been Bedrock's mission from the beginning, is let's not just look at physical care or cognitive care. Let's look at every piece of care that might be necessary for that patient.
I want to make sure that our audience, we make this, that we clarify that Sophia is designed to provide personalized assistance and support throughout the entire healthcare journey. And I think that's key, Brittany, because right now the average physician visit continues to plummet in time. It used to be 10 to 15 minutes. Now it's 5 to 7 minutes, right? The unfortunate time with our physician continues to decrease. So the ability for humans to be able to take care of you and be able to look at the whole picture, to your point, holistically, are becoming more challenging, right? So let's take AI, for example, and put Sophia aside. AI is any type of machine that is able to learn, right? And it's able to learn by way of what we call algorithms. So algorithms that we can specify and will make it learn. For example, let's take an area of medicine such as radiology. A radiologist right now can look at about 50 pictures a day. A good, fast-paced radiologist. An AI-equipped virtual care concierge like Sophia can look at 31 million medical journals and can look at as many pictures in the morning as a physician does in his entire career, lifetime. So it's not replacing that physician. It's giving that physician better data so they can make more efficient, effective, data-driven decisions at bedside. So imagine a physician being able to compare the norm and the abnormal of a medical condition. Think about the impact that that's going to do with patients who are afflicted by chronic conditions. The ability for the AI tool to give the physician, with someone with cardiac disease, the different variances in echocardiograms, arteriographies,
weight loss and gain.
Again, it's endless. So it's basically arming ourselves the ability to have better outcomes, which is the whole premise behind value-based care. So one thing I wanted to talk to you about, again, this goes back to Sophia, is how it aims to improve patient outcomes, enhance patient engagement, and optimize healthcare delivery. So from that standpoint, think of our seniors right now. And when I think of our seniors and the fifth leading cause of older adult decline being social isolation, let's talk about that. The engagement that it's going to give our residents, our patients, our clients, especially those that live home alone, and that potentially don't have the ability, as you mentioned at the beginning, to transportation and access. So how do you think Sophia, as an AI machine learning virtual care concierge, will be able to maximize the level of healthcare delivery for that patient living at home with difficult access to patient care?
It's definitely more of a loaded question. So to break it down to the beginning level of it, the outcomes are going to be what we call confident medicine based outcomes. So when we have that team that has access to what you are doing from a healthcare level day to day, you mentioned some of those vital sign shifts. Heart failure when you take your weight in the morning and then it fluctuates by the evening. That AI tool and the access to the amount of information that it would have we already personalize that range for the patient, so we know what's normal to them and what's abnormal to them. So let's span beyond that, right? So that's where Sophia can really integrate those outcomes instantaneously, because she is going to know when that aberrance has happened. So we get to know the individual, and it allows us to even more personalized than the services they offer is the relationship that's built with the team and the patient. So that alone is going to increase outcomes and really enhance the patient's experience with their primary care team. The second half of that is for an engagement from that social isolation aspect. Luckily, a lot of what we're able to do now revolves around telehealth, so they wouldn't have to leave the house to see one of our practitioners. But ultimately, it's somebody to speak with. I don't know how frequently you communicate with your Siri or Alexa, but she sometimes seems like my best friend. She even, will listen to me when I haven't asked her to. So thanks for being so alert, but I actually don't need you right now. So it really brings about the feeling of somebody else who's watching after you. And for seniors living at home, a lot of times their health is a very scary aspect and piece for that senior living at home. The falls that could happen, any medication errors that could happen. There's a lot of things that you just don't have the security on when you live alone at a certain age. So having somebody that connects you with multiple people. I mean, we have a team of clinicians that build a relationship with that individual. So you can instantly say, hey, Sophia, set me up an appointment with my primary care physician. We can bring them on from a telehealth capacity without even having them leave the house. So it does offer a lot of advantages. But let's say they're not as tech savvy. The vocal recognition of what they can do and speak and visualize will go a long way to giving them more options of care. But ultimately, our team also consists beyond just the clinical side of that holistic care. What about the social determinants of health? So you can even speak into Sophia and say, hey, can I speak with my social worker today? And we would get you set up with that conversation. So again, if it's something transportation-based where you do need to go into a hospital or you have an appointment that cannot be done telehealth-based, we can help set you up for that, because ultimately your journey does not start and end with Bedrock. It does not start and end with Sophia. It's going to be a coordinated effort to make sure that on that journey of your healthcare, whatever that might look like, as complex as it may look like, we are going to be extensions of that care, from just the engagement from an AI tool to that connective piece to our clinical team, to external tendrils that bring in more outside referral sources and groups to help that individual at whatever state that holistic care is demanding from them.
And you mentioned something that was extremely important. You mentioned the need for physicians and healthcare practitioners to practice what we call optimistic, logic-based medicine. And I agree with you 1,000%. I think the optimism behind our clinicians is really wavering, because unfortunately everyone has a cousin called Sue, right? Liability is a big problem. And I do agree that having an AI partner, right? Having a Sophia be able to facilitate that journey, not only to the patient, but the clinician, allows the clinician to stop practicing defensive medicine, which is what we see a lot of our clinicians, especially young clinicians, practice, right? That don't have that level of experience, right? It's for a radiologist who have seen thousands of pictures throughout their career versus one that just got out of residency. It's a big difference. But when you can equip a young clinician with all of the possible data that exists that compares that optimistic medicine, becomes just something that is status quo for everybody. So switching gears a little bit.
Well, I just want to mention too, from that fear perspective, our technologies are HIPAA compliant. So that's a huge piece of healthcare, right? The protected health information. So we make sure the security goes beyond just that healthcare picture. It's also technology based. So yes, we still keep that PHI protected for you through the HIPAA compliance aspects and routes that we've taken with Sophia.
And that was going to be my next topic. My next topic was going to be, I wanted to address the patient concerns and just the concerns that everybody has with privacy of their healthcare record. We give our information, our personal information, to everyone. We don't even know it, right? To our social media sites, to our bank. Everyone has all of information, right? We always talk about everybody's personal social media and internet footprint. But let's talk about that, because Sophia, again, we are... The inner workings and the framework behind Sophia are to maintain the confidentiality of patient care. And again, I think that is one thing that has restricted clinicians and patients from joining the technology journey, and the fact that they feel that there's going to be a violation of their private information, so I don't want to join. So let's talk about that, because I do agree that's a very important aspect of what we do, and the fact that Sophia will protect and take care of the data of each patient, and will make sure that the data is only used to, again, promote predictive human innovation analytics. It'll help us provide better care to you and provide better care to someone who has a similar condition like you. So let's talk to the audience about that, because I know that's something that we're being very careful with, in making sure that when Sophia gets unleashed into the market, that it's something that, again, the level of information from our patients, you mentioned PHI and HIPAA, that's protected.
Mm-hmm. Absolutely. It's a huge concern that we have. An easy way to negate that is actually to have all of your clinical team members under one roof, the Bedrock team. So we knew that was an issue even before we brought Sophia in. So we wanted to make sure, if we have to communicate between different clinicians, that they all are our physicians. They are our clinicians. So that sharing of that PHI it's already understood, because your healthcare team is part of that same continuum. So we have made it a little bit easier, but in terms of the actual data, it filters right into our own system that we monitor, and we make sure it goes back to that very patient that we got it from. There is no communication with outside parties without, of course, that communication back to the patient on those allowed individuals that can have access to it. So we do take the proper precautions, the proper steps. It is patient and individualized and personalized focused, as we said, very driven in that regard. So we can't really use one person's data and replicate it because it is personalized to that individual. So there are a lot of routes that we've looked at to make sure that that security is in place for these individuals. It's very tight with PHI just across the healthcare spectrum because it's very difficult, actually. That's what makes it difficult for a doctor in an ER to see a patient for 5 to 7 minutes and have to know everything about them, socially, physically, mentally, and that full health picture. So it's already been a bit of a struggle. It is very protected as is. But again, when you have that team behind you that is all involved and interconnected in the space, then we reduce that burden. Also, just from the speaking perspective, because you mentioned the social media sites and just anything you put on the internet, who knows where that's gone, but it never actually leaves. So we do want to be careful about that. But since it's more of a technology-based platform, as I mentioned, we did assure that all of the communications within that software are all HIPAA compliant for those patients utilizing the service.
While Sophia might be breaking new ground in healthcare, the Concierge AI tool is nothing new, and if we look at companies like DoorDash, Uber Eats, right? Amazon, Kayak, hotels.com, when you're planning vacation, OpenTable, right? To do dinner reservations. Think about that. You are using AI in all those things. And all those things need your information to be able to help you. So I think it's just healthcare's time is long overdue to really join the AI, the AI revolution. And I say this all the time, Brittany. In the 20th century, electricity became something that we couldn't live without. In the 21st century, AI will be the electricity of the 20th century. We will not be able to function as a society without AI. So again, the embracing of Sophia for us is not an option. Is a way for us to have the opportunity for the first time ever as a healthcare company to be able to lead from the front. Because as healthcare organizations, we've always had to catch up from behind. So I'm excited that, again, this is more of, yes, we're unveiling Sophia to our listeners and to the audience, but this is a call to action. This is a call to action, and I want to encourage our listeners to learn more about Sophia. Learn more and explore about its features. Reach out to us and let us know in what particular ways you would like us to evolve Sophia. And to learn more, make sure you subscribe to our YouTube channel, where we update you weekly, daily, and monthly about all the initiatives and the innovations that are coming along, like Sophia, to make sure that we provide the best care possible to our patients. And again, I really want, Brittany, this conversation to invite feedback from our listeners. And we love to hear the listeners' thoughts on Sophia and how it can improve the healthcare experience for you. So let's take you, for example. How would Sophia change your life or the life of a loved one? And then I'm going to share mine, because I have one specific family member that I think Sophia is going to absolutely change their life.
Yeah, I think I know who you're going to bring up, but I'm going to go to the other end of the spectrum, actually, the future of Sophia. We are targeting a certain demographic right now, but I have a bigger future for Sophia. And I think it is going to be an integration with the technology that the youth is wearing right now. So the watches, the necklaces, I got tattoos out there. There's so many ways that even as a healthy 20, 30, 40-year-old individual, you can start to track your health. This is not a new initiative that's arising. It's clear that it's a need, but people are not and have not been efficiently tracking their health at any age. So how are you going to start to know? A lot of times symptoms mean something's already wrong, right? Now we have to figure out what that is and just put a Band-Aid on the symptom for now. And do we ever actually get to the root cause? That's the question. So starting healthy. is actually where I see Sophia growing into long term for that, for myself. You know what I mean? So it's like, where does my Fitbit data go? Is my heart rate too high for my age and my activity level? I'm already asking those questions, and I'm not a clinician. So just knowing that if I could ask my Fitbit, hey, Sophia, my heart rate's been high the past few days, it seems abnormal. Then again, they can cross-reference all the data that's out there, the journals that are out there, just from that AI technology standpoint of it. But flip side of it, if it can connect me to my care team, they're gonna know. Like, no, I haven't called you because I think it's normal for now, but we do want to keep an eye on it. Or if something irregular is happening with my heart rate or something that I maybe wouldn't identify, that data at least is going to a team that I know it has my back from that health perspective, gets to know me in my health journey. So I'm not doing it alone. And I also don't have to rely on just one physician that I have to get to every time. Again, it's an enhancement of the care that I would normally receive. That's what Sophia does. It enhances the care one already receives from Bedrock. So whoever I call my clinician, it's going to be able to be that care coordination step from a virtual AI perspective. And the youth is really grasping the AI understanding and experience. So I think for me, I can see it helping as I matriculate into different journeys on my healthcare path. So I start from a baseline and I work into different levels of what may come, those exits that I may have to stop off on the super highway of healthcare.
I love it. I love it. And you alluded to something that I wanted to mention earlier, and it's that how the future of healthcare is and how the future of Sophia healthcare driven delivery will be. And that's making healthcare invisible. That's making healthcare seamless. That's making healthcare preventative. And that's making healthcare engaging. So invisible in the aspects, to your point on the wearables, where it's going to be tracking your medical function, or I should say your systemic function, continuously, and only engaging you, alerting you when it's necessary, right? And making it seamless to the point that, again, an AI concierge like Sophia can read those totals to you without any cumbersome or without you stopping your day. And preventatively, so like you mentioned, there are clinical factors. There are, some signs that the body gives off when disease is either manifesting or, God forbid, fully exacerbated. And that's where that AI concierge will do that for you. Where do you think I was going with where I feel Sophia would change the life of someone?
Your mother.
So Sophia will change my mother. My mother's 70 years old. That population is already, to me, determined that Sophia will change. But I am actually going to surprise you.
Oh.
I think in the irony of Sophia, I'm looking for the future of Sophia to take care of people like my daughter, Sophia, the adolescents, the youth, where I think if we are able to teach the youth how to take care of themselves better, we'll have a more healthier population when they get to be in those 65, 70s. So my daughter, Sophia, is 13 years old. She was the inspiration behind Sophia. And the irony of it is I want Sophia to really target that population, the adolescents, the youth, because not only are they dealing with physical issues, but also mental issues.
Oh, absolutely.
Right? And the prepubescent hormonal changes and a lot of the emotional issues that kids go through. I would love for an AI tool like this to facilitate that journey, because one of the most difficult journeys we ever take in life is being an adolescent, right? It's coming into your own, going through that prepubescent and then puberty level where you don't even like yourself or you're not even comfortable within your own skin. So imagine having an AI tool that allows you to be comfortable within your own skin.
I think of young women, with all the changes that they have and might not have a mother around to have some of those conversations. I definitely think that's a huge target that I think we're missing, because the healthcare journey doesn't start when you're 50, 65. It starts when you're born, literally.
Yeah, I agree, Brittany. We always tend to think that I'll go to the doctor when I'm older.
Yeah.
I'll worry about the hospital when I'm older. But if you actually worry about it when you're younger, you may never have to worry about it at all. So again, I wanted to really emphasize that to the audience, that I think where I see Sophia and AI virtual care concierge really taking care of patients is with the young, well population, because when we take care of patients when they're well, they stay well. And imagine being able to take care of our youth so that the youth of tomorrow is healthier than the youth of today.
That's real proactivity.
That's preventative care, and the best care is preventive care. So I wanted to emphasize to the audience as a closing comment that back to my original inspiration of why I wanted to create Sophia, it was my daughter. It was my daughter, and I've always known that my daughter, with Sophia by my side, my future has never looked brighter. And I want to make a proclamation today, Brittany, that with Sophia by our side, the future of healthcare has never looked brighter. And I'd really want that to be the take-home call to action message today to our listeners, that don't fight it, embrace it. And what's the best that can happen? You can live a healthier life. You're not going to get sicker. You're not going to get worse, right? You're only going to get better. So I really believe that not only does the next stage of healthcare begin with the unveiling of Sophia, but a more vibrant, healthy demographic that we will see, because we have to accomplish the following two things. We have to make sure that we change the habits of yesterday, but we also have to make sure that we leave healthcare better than we entered it. I'll give you the last words, Brittany.
Oh, give me the last words. I never thought I would hear you say that. I'm like, okay, wrap it up, Andre. My call to action with Sophia, because we are trying to change the habits, let's change them from the youth perspective. Like, we've got our seniors, I think, figured out. As long as people embrace what we're putting out there, you're going to see nothing but better outcomes. So I think, for me, the way that we start to change that mentality is starting with the youth. That's how I'll send us out.
I love it. And we are changing the habits of yesterday by creating the new healthcare reality of tomorrow. Thanks so much, Brittany.